and helping those in need despite the COVID risks involved. We've heard stories of food and agricultural workers continuing to do their jobs despite the inability to socially distance from one another due to their work environment. These are people who work hard every day and don't have the option of teleworking from the safety of their home. Each of these sectors has continued to go to work day in and day out to ensure that life in Pennsylvania has continued. In the state's interim vaccination plan, which will be updated with today's announcement in version 8, frontline essential workers in phase 1B are those who cannot work remotely and must work in person, where social distancing is not possible and they must work in close proximity to the public. Specifically, we have seen that these 4 sectors have been challenged during this pandemic: firefighters, law enforcement officers, grocery store workers, and food and agricultural workers. That is why Governor Wolf and the Legislative Task Force have developed a special initiative to vaccinate these workers. Using the Pfizer, Moderna, and Janssen, also known as Johnson & Johnson, vaccine that will be shipped directly to retail pharmacy partners and our provider network, we will be working to ensure each of these groups can start scheduling vaccination appointments starting today. This means that they can get vaccinated close to home in the communities where they live and where they work. I want to be absolutely clear that all individuals in these groups, including all farm workers and food and agricultural workers, are eligible for vaccination now, regardless of immigration status or citizenship. Launching these special initiatives allows us to address demand and vaccine hesitancy while keeping our current vaccination progress moving forward. And we are making progress. This week, the CDC ranked Pennsylvania 12th in the country in terms of percentage of population receiving at least 1 dose. And Pennsylvania is first among the 10 largest states for first dose administration. Vaccine providers are averaging more than 83,000 shots into folks' arms every single day. We are very close to completing phase 1A and have already used special initiatives to vaccinate teachers and childcare workers in phase 1B. We know that some providers are working through today to schedule appointments for folks in 1A. But we also know, because we asked providers, that beginning this week through the next 2 weeks, providers are reporting an increase in available appointments. When we asked, providers representing every region at that time said that they had available appointments starting next week. Anecdotally, we are hearing from providers across the state, including densely populated regions like the Southeast and the Southwest, that they are ready to move to the next phase of eligibility. Because of the focused provider network that we created earlier this month, local providers now have better predictability into the supply so that they can schedule out rather than relying on slow-moving wait lists. We listened when folks told us that they would rather have a scheduled appointment than be on a waiting list. We worked to make that a reality. We are seeing increases in vaccine supply and increases in the direct federal allocation to retail pharmacies. As we are ramping up per President Biden's directive, these increases will assist in reaching those goals. This is important because as of April 5th, we will be moving to phase 1B in Pennsylvania. In phase 1B, a number of other frontline workers in fields such as manufacturing, veterinarians, U.S. Postal Service workers, clergy, and public transit workers will be eligible to be vaccinated. Phase 1B also includes vaccinating people in congregate settings, such as behavioral health, correctional facilities, and domestic violence shelters. 1 week later, on April 12th, we will be moving to Phase 1C of our vaccination plan. Phase 1C includes workers who are essential to continue critical infrastructure and maintain the services and functions Americans depend on daily. These too are workers who cannot perform their duties remotely and must work in close proximity to the public. And on April 19th, 2 weeks ahead of the President's directive, the Commonwealth of Pennsylvania will be prepared to open vaccine eligibility to all Pennsylvanians 16 and older. I want to highlight that the ability to move through these upcoming phases quickly is due to the commitment of local vaccine providers and also the estimates of vaccine we anticipate receiving both to the state and through the federal retail partners. As the federal government's role has increased, Pennsylvania is again adapting. As more providers receive vaccine, whether from the state allocation or from direct federal allocations, we will be continually updating the online provider map to help people find vaccine near them. The COVID-19 vaccine is safe, it is effective, and we want each person who can receive it to do so as soon as possible. Remember to continue to wear a mask, even if vaccinated, while out in public, as we work to protect those who have not yet received the vaccine. We also ask Pennsylvanians to continue to socially distance, and when out in public, making sure to wash your hands and take steps to protect one another. Our ultimate goal has always been to get shots into people's arms efficiently, effectively, and equitably. We believe this plan will bring us one step closer to that goal. Thank you. I'm now happy to introduce Senator Art Haywood, a valued member of the COVID-19 task force. Senator Haywood.
Thank you very much, Acting Secretary Bean. Glad to be here. We have faced a challenging situation from the aggressive timetable of President Biden. Initially, we had a framework where we thought we would get everyone vaccinated in June. Then it moved to May 1st. And then the president indicated he'd like to see us get everyone eligible by the middle of April. Obviously, this had an impact of reducing the phasing of 1B and 1C. However, what has happened is that the president has dramatically increased supply. And April and May will be nothing like February and March, because we will be getting supply not just from the pharmacies, but our own supply as well. In fact, Secretary Beam has indicated that the pharmacies involved may double. So this creates the framework for the action that has been described today. This action also includes increasing supply to counties directly in the Southeast. That's a very important step. And the task force has also looked at making sure we have equity and reward providers who are providing equity. We have a very changing situation with the vaccine. but I'm glad that we have been able to adjust to the changes. Thank you, Secretary Beam. Turn it back to you.
Thank you. We will now take questions. If you please raise your hand, we'll go ahead and get your questions answered. Okay, first we have Tyler Pratt. I'm going to ask you to unmute. All right, you should be unmuted now, Tyler.
Good afternoon. With the rising cases in this state, is Pennsylvania still on track to open businesses more and reduce restrictions this weekend?
Thank you so much. So, as we have indicated, we continuously evaluate Pennsylvania's ability to progress through any relaxation of mitigation efforts. We are closely watching our case counts, our hospitalizations, and our deaths. We are also really investing in what today's announcement indicates, which is a progression through having a greater population vaccinated. And given all of those considerations, we are still on track to proceed with the relaxation of mitigation efforts as the governor previously announced for this Sunday.
Thank you. Up next, we have Jim Melwert from KYW News. And give me one moment, Jim. All right, you should be able to unmute.
Senator Haywood touched on it a little bit, but I know there was a pledge made to southeastern PA counties that no one would move to 1A till everyone was through 1B. If you could kind of explain, build out what he was talking about, and also discussions with southeastern PA leadership as this decision was made.
Sure, I'm happy to start, and Senator, if you have any additional perspective to offer, I'm glad to make room for that as well. So we have been in close contact with our provider network, really monitoring what their demand has been. And we have actually heard from providers in all regions of the state that there is the ability to move to phase 1B and really address what is becoming a demand problem. In that, we are still committed to making sure that we are actually having the Janssen allocations go into these communities. So again, to make sure that the volume of shots is where the demand currently exists. We are obviously going to proceed with having a certain 42,000 shots go to the southeastern PA, which will also help progress through any of the remaining phase 1A eligible individuals as we progress into phase 1B next week. We also just want to make sure to note, just as a clarifying point, when we speak to Pennsylvania going into phase 1B, individuals that are in any of the previously eligible phases can still go get vaccinated. We want to make sure that folks know that this is a process whereby we are just increasing the amount of folks that are eligible. There is not at any point a prevention from going if you were once eligible. You should still go get a vaccination. But Senator Haywood, is there anything to add there?
I would only like to add that the increase in doses, particularly the Janssen doses to the Southeast, is a very important part of this effort. And I think it will go a long way in dealing with not just those who are in 1A, but 1B, 1C, and thereafter, because this is a commitment of additional doses over time, not just for 1 week. So I believe that will make a significant difference in dealing with our challenges in the Southeast so that our folks who have a high demand for the doses can be satisfied.
Thank you. Up next, we have Chelsea Johnson from WJAC. You should be able to unmute.
Good afternoon. Thanks for taking my question. We saw how phase 1A was prolonged, if you will. So how is the state going to ensure that each phase will start on its designated date?
So we have really been able to be in a different playing field than we were in January when we talked about phase 1A and really growing it at that point. The supply projections, and especially with the increased approval of the Janssen vaccine, have allowed us to more quickly accelerate what really was our planned progression through many of these phases. With that being said, we will always, and we have remained committed to, staying in very close contact with our provider community to understand where they are able to actually translate anyone who's interested in an appointment getting into a scheduled appointment. And I think if we do find that there's any reason to pivot at any point, we've been nimble this whole time, and we will continue to be able to advance different strategies as other curveballs are thrown our way.
Thank you.
Thank you. Up next, we have Jim Madalinsky from WTAE.
Good morning. Do you have approximately a number on how many Pennsylvanians you think are still left to be vaccinated? And with that said, now that people are going to see that this is now open to everyone as early as 3 weeks, I imagine appointments are going to fill up fast. Do you expect it to be a point where we see another backlog with appointments? And what are you telling providers to plan for as far as a potential surge in people signing up and trying to find appointments right now?
Sure. So I'll go through the estimated populations per phase, but I just want to start with your basic question at the end with how do you work through that wait list? Really, this was our commitment to the provider community that we were able to do through the predictability of that provider network. And so we've been able to tell our providers, you are going to get at least this floor of an amount of vaccine week over week. And so you can rely on that. You can schedule on that. Previously, we were in a world where that predictability didn't exist. Now that's going to allow them to not just form wait lists, but really schedule out. And so with that, the remaining 1B population is roughly 0.7 to 1 million, which are the individuals that are actually going to be eligible for being vaccinated today. The remaining, that's not true. The 4 targeted populations are 190,000 to 250,000. Those folks are going to be able to be vaccinated today. The remaining 1B population that will be able to be eligible for being vaccinated on Monday is 0.7 to 1 million, and 1C, 1.3 to 1.7 million on April 12th.
Okay, thank you. Next, we have Mike Rubenkamp from the Associated Press. Now, he's unable to unmute, so I'm going to read his question. He's wondering to what extent variants are driving the increase in cases.
So the presence of the variants is an issue that we've struggled to have full visibility into. As a country, we have limited surveillance capabilities that have allowed us to understand where that genomic sequencing is able to be deployed. Nonetheless, we are continuing to work with the federal government to make sure that where we can have those cases really tested, that we do have a significant, I think really our way of looking at it is to make sure that we are abundantly cautious where those variants are discovered, because they're likely indicative of a greater presence than even our case count indicates. And so the variants are contributing factors to the increase in cases, no doubt, but we're going to continue to try and increase our ability to have an understanding of really how many of our cases are generated by variants to understand the presence in Pennsylvania.
Next, we have Sam Rowland from the York Daily Record. Give us one moment, making sure you can unmute here. Okay, you should be unmuted, Sam.
Yes, my question is in regards to the mass sites that were going to be in southeastern Pennsylvania. Are there still plans to start those up?
Sure. So because of the federal government's shift in their strategy, as they announced Monday, they, by April 19th, expect that 90% of individuals will be not only eligible for a vaccine, but living within 5 miles of a vaccinator. That gives us an understanding that the federal government is really going to take on what was our mission that was really going to be delivered by the regional vaccine clinics, which was getting at volume. Volume now through their allocation and truly through their activation of so many of those federal retail partners will be delivered on by the federal government strategy. With that, we pivoted and we knew that the regional max vac sites, at this time, the operational lift associated with them was not the most prudent use of our resources. And so instead, we're taking the vaccine and we're investing it directly into the counties, how their local leadership has requested that we invest it into their counties and their provider community.
Next, we have Andy McCormick from 6 ABC.
Hi, and just following up on Sam's question again about southeastern Pennsylvania. This question is for Senator Haywood, as the only senator on the COVID-19 task force that actually represents that area. I heard the acting secretary say that this is because of the federal involvement and the amount of vaccines coming, but how much did the back and forth, I mean, the counties are really upset, really vocal with the state. how much did that play into your decision to give it directly to the counties? And also, just for clarification, when you're saying the county sites, do you mean the actual county sites in addition to pharmacies? Or are there more pharmacies that are now in play? And will that be in addition to the counties?
So in terms of the allocation, I think Secretary Beam has already shared that the allocation will go to the counties. And second, in terms of the factors in decision-making, a large number of factors were in play. And of course, the positions of the counties and the legislators. But I would say this, we're in a situation where we've got to react to a lot of different factors, including President Biden's decision to put vaccine into the pharmacies. We have to adjust to that. And I do also want to share in terms of one other question that was raised. Once President Biden says he wants 90% eligible by April the 19th, that shrinks all of the priorities. There's no way you can have a long phase in of these priorities when there's only 3 weeks of time remaining.
Okay, thank you. Next, we have Barbara Barr from WGAL.
That's a good question.
Yes, thank you for your time. Acting Secretary Beam, can you clarify now that the frontline workers are eligible now and the others in different phases, they're going to make their own appointments? How can you say that there won't be the frustration that we saw early on in trying to schedule appointments now that it's being opened up to so many? And here in Lancaster, we have a mass vaccination site. Their goal was 6,000 a day. They haven't been able to get near that at this point. Are they going to get that many shots?
Thank you. So as I think we've mentioned earlier this week, we are really investing in the Lancaster site for the South Central region, but then I think the regions broadly to make sure that the allocations are increased. So we are on a different playing field than we were previously in the amount of supply that will be coming to us, not just this week, but through the month of April. And so that's going to be truly game changing for allowing it to not just be folks waiting in line for the actual vaccination appointment. But there's one other key part that I just want to make sure folks understand. We now are giving the provider community predictability. And so they no longer have to worry about waiting on our weekly allocation communication before they schedule an appointment. We know that they rely and their business operations rely on that predictability, and rightfully so. And so what we're giving them in allowing them to know what the floor will be, what the minimum amount we'll be allocating to them that following week, allows them to really schedule out for weeks on end. And it's a very different circumstance than we were in previously when we had opened up phase 1A to additional folks.
And just a quick follow-up, if I may. Are people better off going to make an appointment at a mass vaccination site or a pharmacy?
So we would advise that you get the appointment that's soonest to you. I think at this stage, we really have advised folks that the vaccine that's best for them is the one that they're able to get that scheduled appointment for. And so we'd stay true to that at this point, making sure that folks really are just driven to get the appointment and not necessarily differentiating based on where.
Thank you. Up next, we have Gabriella DeLuca from WPXI.
Hey there, thank you so much for taking my question. With these projected timelines, is there any prediction or an idea of when we can stop wearing masks everywhere and sort of get back to normal a little bit more, than we are right now?
Sure. So the vaccination effort, and really what today's announcement is about, is one piece of it. Getting more folks vaccinated will progress Pennsylvania on that broader relaxation of mitigation efforts trail. But what we also have to be closely attuned to is the presence of the variants, which I think folks have also raised today, and rightfully so. Our case counts are not at a plateau anymore. We are seeing case counts rise, which will naturally be followed likely by an increase in hospitalizations and possibly even tragically deaths. And so all of this is under evaluation constantly within the administration to understand what the right level of relaxation of any mitigation efforts are. The governor's step with the announcement and the proper lead time before making Sunday's relaxation and mitigation efforts gives us time to, I think, evaluate properly how that impacts our case counts and the presence of the virus in Pennsylvania before contemplating future relaxation of mitigation efforts.
Next, we have Aaron McCarthy at the Philadelphia Inquirer.
Hi, Secretary Beam. As you mentioned, today is the deadline for providers to have appointments made available for everyone in 1A who wants one and still has not been able to get one. You mentioned that in areas, including the Southeast specifically, that up to 90% of people in 1A had been vaccinated. The percent of people who want appointments have gotten those shots. How do you know that? And how exactly are you tracking that and ensuring that no one in 1A gets left behind as we move forward?
Sure. So the way we've been able to continuously review our progress on phase 1A is that we have calculations and estimates of who all would qualify for phase 1A. And even with an aggressive uptake assumption, meaning that 80% of those folks that are eligible would actually want to go get vaccinated right now, we still have, as you mentioned, the Southeast, based on the vaccine administration data, has already had 90% of those that are in 1A that have actually gotten a first dose in their arm. We have regions of the state that are as high as 95% based on the estimated population compared to the administration data. And so again, we've used this in conjunction with very frequent provider communications to understand how their scheduling is progressing and their still available appointments that we discussed that really is indicative of the need to solve for the demand problem, which is progressing through these phases as we outlined today.
Next is Scott Beveridge from Observer Reporter.
Yes, thank you. Here in Washington County, the vaccines have already been offered and also administered to a lot of people in the county prison, the police, the firefighters. They've already been vaccinated. So, I mean, is there a problem with communicating that you're opening this up to people who have already been vaccinated?
So in accordance with our provider agreement with the provider network, they should be conforming to our phases. And our phases still have Pennsylvania at phase 1A with the addition of teachers and child care workers. We are progressing quite quickly, as you mentioned, to meet really what is now going to be the demand problem, because it's in jurisdictions, it sounds like in your county, we're able to actually get through 1B, be able to start even on 1C in 2 weeks, and possibly have universal eligibility for all of Pennsylvania, which will really help meet the demand requirements. And so we have worked where there are providers that have jumped the phases. We have worked to better enforce our allocation around those providers, and we will continue to do so and closely monitor for compliance with our phases. But more than anything, what I think your question evidences is really the need for us to progress through these phases as quickly as possible.
Next is Essie from Spotlight PA.
Hi, thanks for taking questions today. I see other states are planning clinics for manufacturing workers at large sites. Is Pennsylvania planning something similar, given how many cases this population saw?
Yeah, so we've been working very closely, specific in the food and the agricultural industry, to make sure that we are able to have partnerships where there are providers that are in the provider network or eligible enrolled providers that have received vaccine that can partner with a few of these large companies and really get that vaccine into those employees' arms as quickly as possible. We have facilitated those partnerships, and we hope to be able to do more as the supply increases.
Next is Jamie Bittner from Fox 43.
I want to switch gears here a little bit and ask you about something else happening today. You mentioned COVID cases still rising, a lot of talk about a possible third wave, and the talk in Harrisburg today was about the stockpile and how it's only in one central location, and there's some concern of now that it's public where that stockpile is, that it might be tampered with, or there could be, cause of a fire or so forth, and you could lose your entire supply. Do you have any concern about that, as there's no plans to move it until at least summer? And number two, when will you allow the media in to see that stockpile, and when will we be able to see it?
So as you mentioned, this is active conversation, and I know my counterpart, Director Padfield, was with some legislators today speaking about exactly this. He is best situated to talk about it, but I think broadly speaking, what we've allowed that PPE stockpile to be utilized for has really been reflective of the need in the crisis to cross-utilize existing space that the Commonwealth had that was of such magnitude that it could handle really what was a significant amount of PPE. We've been working to also make sure that it's safe and secure, because as you properly articulated, now that so many folks have spoken about where that location is, it clearly has some threat in being able to make sure that it is utmost secure and that we don't have that stockpile compromised. And so I believe not only Director Padfield, but also our partners over at the Department of General Services are working around the clock to make sure that that stockpile is not just preserved, but then used as effectively as possible to meet the needs of our communities.
Up next is Davine from the Beaver County Times.
Thank you guys so much for giving me the opportunity today. I'm going to kind of go back to the horse I've been beating for several months now. Our rural communities are still seeing low vaccination numbers, low provider numbers. The data that you guys are posting is backing that up. We're also still seeing higher case counts in those areas. What is the department doing to help close that equity gap, particularly in counties like Beaver and Fulton and the places that are at the bottom of that equity of that percent of folks who are being vaccinated? And how do you think that is at all being driven, that low percentage of folks vaccinated with the higher number of cases that we're seeing from some of those communities?
So I want to make sure that we also allow ourselves to fully understand where two issues are currently at play. First, the allocation. The allocation we've been very clear with on our factors for each county's allocation, and we've worked to bring each county, to the extent the providers request it, up to compliance with that county-based index. And so we want to make sure that our rural counties as well as our urban counties are also receiving all of the vaccine that we believe their population can actually handle and their providers can handle. What you also highlighted is the administration data. We know that the first part of it is allocation and getting the vaccine there, but actually convincing folks to get vaccinated is an entire other challenge that we need to be focusing on more front and center, because the allocation, we have really gotten down to a cadence that is allowing the providers the predictability, as we outlined today. We'll progress through those phases quickly. But the more urgent crisis is now where we will have an allocation, but we won't actually turn that allocation into an administration because there is hesitancy on the part of the population. That is what we are working across the board on. It's not just equity with regard to race and ethnicity. It's with regard to geography. And some of our rural areas are going to be our hardest to reach communities. And so how do we collectively partner on making sure that folks understand that the facts and the science are there, that we have the health and safety of our communities is reliant upon us getting vaccinated, and that the freedom that so many folks want and the local control will be facilitated best when we have the most folks vaccinated in the community.
Thank you. Next, we have Sarah Bowden from WESA.
Hi, thanks so much for taking my question. So I want to follow up on a couple concepts that we've been talking about today, both the fact that restrictions are going to loosen on the 4th and the fact that we are in a surge. So I spoke to a lot of people in the food industry sort of sphere, and they feel like their health is being put at risk by the governor deciding that on April 4th, all these restrictions are going to loosen. They're in one seat. So that means they don't have access to the vaccine until the 12th. And as you know, it takes a while for antibodies to build. And so they feel that the interests of businesses are being put over the interests of their health by allowing them to work in environments where they will be at increased risk, because we know that bars and restaurants, epidemiological information shows that these are risky places to be. So why, can you directly talk to these folks? Can you tell them why it is appropriate to allow them to work in more risky environments when they won't have experience the full benefits of vaccination for at least a month?
So speaking to the food industry broadly, which I believe you referenced, you have to remember that as far as the manufacturers and the agricultural workers, those are the ones that we're working on actually opening up vaccination to today. Speaking to the restaurant workers and the populations that are working the restaurants and bars, we are incrementally increasing the occupancy within these facilities. We are not at all flinging the doors wide open. And so there are still protections around how we're going to conduct ourselves when in these facilities, which will be able to be operational. And so you still have masking, you still have social distancing. There's still compliance with even our process that we set up through the DCED, making sure that folks are able to comply with really attesting to best practices for cleaning and other protocols. And so I want to also offer that the incremental relaxation that starts on Sunday, and especially in the restaurant and bar industry, is not just flipping the switch entirely. It's allowing us to lightly progress through the relaxation and mitigation efforts while closely monitoring how folks are complying with all of our parameters around our safety and making sure that folks can actually operate these businesses safely.
Okay, and our final question for today is going to be from Bo Colt now at WFMZ.
Hey, thanks for getting me in for the last question. I really appreciate it. Today, Pfizer came out and said that their vaccine is 100% effective for 12 to 15-year-olds in their clinical trials. They hope to have these shots available by fall. Does Pennsylvania have any idea how a rollout like that will go? Will it be within these different classification systems for adults? And also, how important is it to have kids vaccinated to reach that herd immunity? Thank you.
So to the second part of your question, having adolescents and then eventually children vaccinated is incredibly important. That's 25% of the nation's population. And so for us to be able to actually reach full immunity as a country, we're going to want to make sure that adolescents and children are vaccinated as quickly and as safely as they can be. To your starter question of how will this go, we hope that this is great news, and we will be working through the best process moving forward. We've been very clear that lessons learned throughout this rollout will benefit the next rollout, and we stand committed to that. And so as we think through the next phases, whether it be adolescent vaccinations or the need for booster shots or the like, we know that we have learned a tremendous amount in the past 3 months, and we expect to use every aspect of what we've learned to inform and improve what we do next.
That concludes today's press conference. Thank you again for joining us, and a PA cast will be available later this afternoon.